Welcome to our podcast, Advancing Health Equity Through Advocacy, Student Nurse Edition, where student nurse scholars are advancing health equity through the art of advocacy. As students and new nurses, advocating for patients and yourself can be difficult. Through this podcast series, our nursing student scholars will introduce you to experts and advocates in the field of nursing that can help highlight ways that you can make an impact on our maternal health crisis and on the health of the communities we serve.
Hi, everyone, and welcome to our podcast. I am your host, Miranda del Valle, a Bass Scholars student nurse at UTMB School of Nursing. On this episode, we will be discussing nursing advocacy through community and professional collaborations. Today, I'm joined by my co-hosts, Nicole and Christine, two of our fellow Bass Nursing Scholars students.
Today, we are joined by our guest, Dr. Shannon Stevenson. Dr. Stevenson, thank you for joining us.
Thank you for having me.
To get us started, can you tell us a little bit about yourself and the work you are currently doing in the advocacy space of nursing?
Sure. Well, again, thanks for having me. This all started for me when I was a labor and delivery nurse in Houston a number of years ago. And after that, I got into education and have been a educator now for 7 years. I currently teach at the Nell Hodgkin Woodruff School of Nursing at Emory University in Atlanta, Georgia. And as far as the advocacy work that I do, I recently joined the board of directors for Healthy Mothers, Healthy Babies Coalition of Georgia when I moved back to Georgia in 2021. And through that organization, I'm able to serve in an advocacy capacity where I work on the advocacy committee. And my specialty area within that is maternal mental health. So I spend a lot of my time working on access to maternal mental health care and ways that we can help moms through the transition to parenthood.
Thank you for the work that you do and for taking time to be with us today. So let's dive into our questions. First question. Can you describe to our listeners what we mean when we talk about community and collaborations in nursing?
Yeah, of course. It's all about intentionally engaging with organizations, and that can be in the nonprofit sector, like the work I do with Healthy Mothers, Healthy Babies of Georgia, and it can even be with social service agencies within your state. For example, the Department of Health and Human Services has a committee on maternal mortality where they invite stakeholders in maternal mortality cases to review deaths in the state and come up with ways that they can be prevented or cases like that can be prevented in the future. And nurses can get involved with things like that. So it's really about just intentionally engaging with organizations on topics that you're passionate about.
To expand on that, can you share why you believe connecting healthcare providers and nurses with the community has the potential to provide optimal outcomes for patients?
Yeah, I think it's really important to remember that healthcare, especially pregnancy, it doesn't occur in a vacuum, right? Our patients come to us with a variety of different lived experiences, their social determinants of health. All of these things are going to impact their pregnancy and their outcomes. And we can't ignore that. I think sometimes when we're in healthcare, especially if we're working inpatient as nurses, we see these patients for 12 hours at a time. And then that's it. We don't get to see a lot of their outside story, what their life is like beyond the four walls of our hospital. So getting involved with different organizations is going to give us context for the ways in which our patients come to us, the conditions that they live in, again, social determinants of health that they might be experiencing. It's important that we see these things firsthand to be able to provide the best care that we can for our patients. We need to know what kind of resources are out there for them, what resources are missing, and really what they need. So connecting with nurses, with different organizations, they could maybe come in and do an in-service for nurses. So let's say, again, maternal mortality. Let's say I'm partnering with an organization in the community and I think, wow, the other staff nurses on my floor could really use this information. We can invite them for a staff meeting and they can do an in-service on maternal mortality. And getting that information and the context for nurses is huge.
Very well said. Can you describe what a professional nursing organization is and provide a few examples of some of your favorite nursing organizations for our listeners?
Of course. A professional nursing organization has a few goals. They educate, they advocate, and they serve the profession and those that we care for. There are such a wide variety of professional organizations for nurses to get involved in at every stage of their career and in every specialty area that we provide care in. They educate nurses on topics that are relevant to us, both for our profession and as well as for our patients. They help us advocate for, again, our profession as well as our patients. And so there are different specialty organizations. There are ones that serve the nursing profession on a broader scale, like American Nurses Association. Some of the specialty organizations are where I've spent a lot of my time. For example, AWON, or the Association of Women's Health, Obstetric, and Neonatal Nurses, is a great organization for those of us in perinatal nursing. They really do a lot with advocacy. They have legislative updates that they send out for nurses to stay on top of different topics and legislative issues that might impact our profession and our patient population. Education, they offer a lot of training for nurses to learn more about things like fetal monitoring. They advocate for our patients with creating courses on things like postpartum hemorrhage and how do we manage that. So AWON's one that I'm really passionate about. As a nurse educator, the National League for Nursing, or NLN, is another one that I work a lot with. They've got wonderful conferences for those of us that are in nursing education to learn more about research that's going on in the field of education and how we can best prepare future nurses. And then lastly, another one that I'm really passionate about is nurses on boards. And this is how I became interested in serving on the board of directors for Healthy Mothers, Healthy Babies Coalition of Georgia. But the whole goal of the organization is to get nurses to the table where a lot of these conversations are happening regarding advocacy, policy, how we serve our patients outside of the hospital or healthcare setting. So those are three that I'm pretty passionate about and that have really inspired a lot of the work that I do.
Well, thank you so much for sharing. And why do you believe it is important for nurses, new and experienced, to partner with professional nursing, medical, and or community organizations?
Well, again, I really think it's so important to remember that the care that we provide to patients isn't in a vacuum. They're coming to pregnancy with so many different experiences that both are positive and negative, and it's important that we address that. I also think that by the way in which nurses are trained brings such value to these organizations. We talk so much about the nursing process and clinical judgment, right? We recognize cues, we analyze them, we come up with hypothesis, we come up with solutions, we take action, and then we evaluate those actions, right? That's clinical judgment. That's how we as nurses are trained. Think about the value that brings to a community organization or an organization that's looking to serve patients in a unique way, that we can actually analyze what they might need and take action and evaluate whether it's helping our patients or not.
And as you know, many nurses join professional nursing organizations but may not know how to become more involved. Do you have any tips on how nurses can make more of an impact?
I think the first tip would be don't be shy. Don't be afraid to put yourself out there. All of these organizations, especially these specialty organizations within nursing, have local chapters where you can reach out, email. They'll have an email saying, hey, or a social media page, and just say, hey, I really want to get involved. They're always looking for people to step up, whether it be in a volunteer capacity, whether it be serving in a leadership position. Don't underestimate yourself and what you can bring to the table. Don't be afraid to put yourself out there and say, hey, I'm really passionate about this and I think I can make a difference. If you think you can make a difference, you definitely can. So really don't be afraid to put yourself out there. Find an organization that you're passionate about what they do. We don't have to reinvent the wheel and come up with our own organizations, right? Especially when we're looking at getting involved with community organizations. There are organizations that have been doing this work for decades, if not generations. So recognizing that they are the experts in their topic and we're just there to add that nursing component and expertise is really important to remember. So don't be afraid. Know the value that you bring and the expertise that you bring and put yourself out there.
Thank you for that advice. Can you share how health policy is informed by these professional nursing organizations?
Yeah, so a lot of them work directly with legislators and lobbyists on topics that are relevant to either their patient population or the nursing profession as a whole. I know AWAN has Nurses Day at the Capitol. I know the Texas Nurses Association has a similar Nurses Day at the Capitol where we go and we meet with legislators and say, these are the issues that we want to see legislators talk about, bills be created about. Action taken because we've got moms to save and babies to save, and we've got nurses to advocate for. And so, it's all about networking and really being strategic in how you communicate. Passion is important, but you have to be able to get your point across in a way that makes sense to legislators, right? They're not in the hospital with us, but we need to be able to bring our stories to them and say, this is what we're seeing. This is what women in Texas, women in the United States, birthing people across the country, this is what we need to help them or help ourselves as nurses. So it's all about making these strategic connections and relationships and just being your authentic self. All of those things are going to help guide policy because we're the ones doing this work and we voted these people in to help us do that work.
Very true. Thank you for your perspective. Can you share a health advocacy initiative that you have worked on, and how do you believe the nursing perspective enriched the narrative or outcome?
Yeah, so currently I'm working on maternal mental health, as I mentioned. And part of what we're doing is trying to see what resources are out there for patients. And a lot of it comes to, the experiences that patients have. Many times it's just with their OBGYN or their midwives or their nurses in the hospital setting. And they might not even know about mental health resources that are available in their community. And I think about my experience as a mother baby nurse and doing discharge teaching with my patients. What were the mental health, education points that I gave my patients? Being able to talk to this research team about what these patients are hearing in the hospital helps us kind of guide the resources that we think that they may need and how we can connect patients to these resources in the first place.
Wow, thank you for sharing. Your passion is very inspiring to all of us. What motivates you to continue pursuing your passions in nursing related to advocacy?
Oh, goodness, that's a great question. I think a lot of it comes down to the things that I've seen. I've seen moms receive less than optimal care. I've seen bad outcomes. I've seen moms come very close to losing their lives, if not losing their lives, or losing the life of their child. And for me, knowing how lucky I've been to have the education that I've received, I have to use it. I have to use my voice. I have to stand up and say, hey, this isn't right. And here are the ways that we can at least try to fix it, try to move the needle on these topics. So, my own personal experience has been something to motivate me, especially in regards to maternal mental health, my own experience with mental health issues following the birth of my daughter. And then, really, my daughter. Being a mom to a little girl is something that pushes me to advocate for anybody who has the capability to give birth or is of reproductive age, and just really wanting to make this world a safer place for them to have babies and to grow up in.
Thank you for sharing a little bit of that vulnerability with us. As we close, can you share with us your top 3 ways new nurses can get involved now to help reverse the trends of maternal morbidity and mortality in the United States?
Absolutely. I think first would be to listen to your patients. I know that sounds so simple and obvious, but how often in the course of a 12-hour shift are we busy? We're running around. We don't have the opportunity to sit down and really talk to our patients, but we need to. And we need to make that time because it's critical. We think about, patients saying certain symptoms or reporting certain symptoms. Like, for example, with a pulmonary embolism, one of the symptoms that a patient might report is a sudden feeling of doom or anxiety. How easy is that to just write off? Oh, you're a new mom, you must be exhausted. It's of course it's normal to be a little anxious, but that's so much more than that. We need to really listen to our patients and not brush off their concerns or their reality, because we could intervene and we can save their lives. Additionally, we need to be comfortable with calling out things when we see them. I think, the hierarchy of medicine has done a disservice to nurses and our voices as well as our patients. If we see something, or if an order isn't, happening, or a stat CT scan isn't stat, we need to speak up. We need to advocate for our patients. This healthcare system is hard to navigate. It's hard to navigate as a healthcare provider. Imagine somebody who doesn't have that expertise in healthcare. We have to call things out, and we have to be the voice for our patient. And then lastly, join an organization doing this work. Again, find what you're passionate about, what makes you wake up and say, I've got to do something about this, and join in on the work. Don't doubt the value that you as a nurse bring, or that you as a nursing student bring. I think sometimes that as students, we get intimidated to speak up and to do this work, but your expertise is valuable as well, and your experience is valuable. So even something like joining SNA as a student, and dipping your toes in the water of professional organizations. And then as you start your career, find the organizations that are your specialty area, or community organizations doing the work, and roll up your sleeves and join them.
Wow, thank you so much for sharing all that with us today.
Yes, thank you so much, Dr. Stevenson, for sharing your thoughts and ideas related to this crucial topic of nursing advocacy through community and professional collaborations. We appreciate you sharing your time and expertise with us, and we hope this inspires current nurses and future nurses to find their space in advocacy.
Thank you for having me. This is such an important conversation to have, and one that I think as students we don't have enough, and we don't value the experience that we have as students. And so it's important that you guys are learning to use that voice and to advocate for yourself and your patients. It's what's going to change the nursing profession. It's what's going to move the needle on issues like maternal mortality. So thank you for inviting me to have this important conversation with you all.
Thank you, Dr. Stevenson. I hope you have a great rest of your day.
You too.
Thank you, Dr. Stevenson.
Thank you so much, Dr. Stevenson. It was a pleasure talking to you today.
Likewise.
For all our listeners, please join us for our next episode, Social Justice in Health, Nursing Advocacy Through Bridging the Gap in Access, as we interview our guest, Mrs. Nikki Hunter Greenaway from Bloom Maternal Health, who is a nurse practitioner, entrepreneur, lactation consultant, and community advocate.
Until next time, remember, you too can have a seat at the table and be the voice of change for mothers, babies, and our community now. The views and opinions expressed on our podcast are not necessarily the views of the University of Texas Medical Branch at Galveston Health System or the UTMB School of Nursing.